Yes.
Okay, perfect. Thank you.
Good afternoon, everyone. My name is Rachel Kitonyo-Devotsu, and I work with Development Gateway as a Senior Tobacco Control Advisor. I'll be one of your co-moderators today, alongside Ngarii Tjejamba, who's our country lead for the Data on Youth and Tobacco in Africa project in Namibia. Welcome to our webinar today, entitled Closing the Data Gap, Driving Tobacco Reform and Cancer Prevention in Namibia and Kenya, with a focus on new and emerging nicotine and tobacco products. We have an interesting lineup for us today. We have 3 speakers. We have Rolf Hansen and Leena Amwaalwa from Namibia, and Phoebe Ongadi from Kenya, and we'll be introducing them as we go along. Please post in the chat your name, where you work, and where you're joining us from. And after the presentations, we're gonna have a question and answer session. So as presentations are happening, feel free to post in the chat, and there's also a Q&A function. Without further ado, let me welcome Ngarii Tjejamba to give us our first presentation and introduction to the DaYTA program. Welcome, Ngarii.
Thank you so much, Rachel. Let me just stop sharing this flyer for now. Thank you for the warm introduction, and begin sharing my presentation. Is it full screen or is it just? Yeah.
Yeah, we can currently see the other slides.
Okay. How do I?
But it is big enough to be legible.
Okay.
Yeah, sorry, I'm not too familiar with that platform that you're using. Maybe if you use the zoom button a little bit.
Let me just see if I can, yeah. Let me just see if I can enter slideshow mode. I hope everything is all.
Oh, that worked.
That worked. Perfect. Let me just go back. So, quick introduction. My name is gently and warmly introduced by Rachel is Ngarii Tjejamba. I'm the data lead on youth and tobacco in Africa. As the country lead, my job is to provide a programmatic lens in the country tool in development by representing and communicating the priorities of key stakeholders. As I push this presentation, I would love to begin by introducing Development Gateway, which is an IREX venture. IREX stands for International Research and Exchange Board venture, and since 2000, the year 2000, it has built tools and systems and dashboards that make development data easier to gather, use, and understand. DG, as it's abbreviatedly known, we enhance transparency and efficiency in agriculture, health, activities in information management, and cross-cutting global policy fields. Our partnerships with governments, institutions, and communities help ensure that they have the information needed to make and shape decisions. In doing this, we identify barriers and solutions for increased data use and apply it in a needs basis to increase knowledge and incorporating the regional learnings to inform the global community. So let me just go to the next slide. So this slide shows the countries that we've been active in. We've just highlighted the countries where it started through the TCDI program which highlighted 3 areas, which were DRC, Kenya, and Nigeria. And the Data on Youth and Tobacco in Africa research survey is aimed at having a household-based national representative tobacco and nicotine survey that is being funded by the Gates Foundation that is targeting 10 to 17-year-olds. And the program is hoping to, begin and conclude in a space of 3 years. It has also been active in Kenya, Nigeria, and DRC, as I mentioned, and with all these other countries being onboarded recently. Now, the key reason for the Data on Youth and Tobacco in Africa initiative is that a gap was identified by the fact that there is a lack of data when it comes to this space, especially when it comes to the new and emerging products, when it comes to how the prevalence rates are. And this has been feedback that has been received from key stakeholders that we've engaged with in country and at a regional level. And this survey aims to give a country specific and, of course, be comparable at a regional level. The current status of the data program is that we are currently in a localization phase. So we kicked off things at the end of 2025 and doing assessment interviews to determine data gaps, policies, and legislative frameworks, engaging with key stakeholders. Our main ministry that we're going to be dealing with, it will be the Ministry of Health and Social Services in Namibia. And we're also working with other key stakeholders, such as the Cancer Association that is on the call today, and other stakeholders that are going to help inform the research and the survey. At present, we have just released an expression of interest in relation to finding an implementing partner who will be a local organization that will help guide and conduct the survey in country. The next phase will be to do the data collection and analysis, and then it'll come down to validation and the dissemination of the data set as it continues. So the data on youth and tobacco in Africa was originally initiated through the Data Control and Data Initiative Program, Data Control Data Initiative Program, TCDI program. And its initiative was to strengthen the availability, quality, and use of data on youth tobacco use across the African continent. The project focuses on gathering, analyzing, and sharing evidence on tobacco consumption patterns, exposure to tobacco marketing, access to tobacco products, and the impact of tobacco control policies on young people. Now, we are, as in Africa, Africa is often known as one of the largest and youngest, population, and it's growing at a rapid rate. And tobacco companies are increasingly targeting emerging products, such as the African continent. And therefore, having reliable data is going to be essential to guide effective prevention strategies, to inform policy decisions, and to protect young people from nicotine addiction and tobacco-related harm. The project aims to support government, public health institutions, civil society organizations, researchers, and advocates by providing accessible insights that can drive stronger tobacco measures, promote youth-focused interventions, and contribute to higher, healthier community across the whole of Africa. So through this evidence-based approach, stakeholder collaboration, and policy engagement on the Data, Youth, and Tobacco in Africa project seeks to empower decision makers with the information needed to reduce youth tobacco use and safeguard the next generation. So I just lost my screen a little bit. Cecilia, are you able to see the screen? Are you still?
Yes, still seeing it.
Okay. Perfect. All right. So this next slide is a brief representation of the dashboard. that will be created after the survey has been done. On the far left-hand side will be the key areas where the survey questions will seek to answer, as far as identifying the prevalence, the initiation, the access, the knowledge of the people who the youth, adolescent youth who are using the tobacco products, the marketing, the cessation when they stopped using it, and further recommendations that maybe might come out from the survey. So the data example here that is on screen is from the Kenya survey, established in 2004, 2024, and it's accessible to everyone who wants and seeks to gain greater insights in relation to the DaYTA initiative and results in Kenya. So briefly, that was just my brief introduction in regards to the data on youth and tobacco in Africa for Namibia. And we hope to seek collaboration with partners in government, civil society, and academia, and DaYTA program will empower decision makers to make timely data-driven policies that in turn can lead to a higher and healthier population and populace. So with that said, I'll be passing on to the next speaker, Mr. Rolf Hansen. Let me just stop sharing it a little bit. And Mr. Rolf Hansen is the Chief Executive Officer of the Cancer Association of Namibia and Palliative Care of Namibia. He's an accomplished senior executive with extensive expertise in strategic business planning, organizational leadership, and policy development, with over a decade of executive leadership in oncology, palliative care, and patient advocacy in the nonprofit space. So allow me to introduce Rolf Hansen. Rolf, over to you.
Well, good afternoon, everyone, from the land of the Golden Dunes, Namibia. I'm Rolf Hansen, and it's my pleasure to be with you this afternoon. Thank you so much to all the amazing project partners who've made this a reality. We're going to jump straight into it, and I hope that you can see my screen. Can someone just confirm you can see the full screen? Brilliant. So we're going to start, and today we're going to be focusing on what's happening in Namibia. And obviously, we're going to be focusing on the Namibia Tobacco Products Control Act of 2010, our current legislation, existing gaps, and proposed amendments to strengthen our Control Act. So our Tobacco Control Act in Namibia was promulgated and acted by Parliament in 2010. It came into power and effect on 1 April 2014 with the specific objectives, and that is to reduce tobacco use, protect non-smokers, especially prevent youth initiation, restrict tobacco marketing, improve public awareness, and establish sustainable tobacco control measures. It's all well and good. You have all these goals, but you also need to have a committee that governs and guides. And then you also need to have a fund, a taxation committee that can help govern and guide so that all of these things become a reality and you can actually control tobacco in our country. So here is an example of the Tobacco Control Act. The key areas covered. The Act regulates advertising, promotion, and sponsorship, which was a huge challenge, as was any other country in the world, especially in Africa. The promotion and sponsorships were a massive challenge. So you would always have these events, promotional parties, clubs, weekend activities, and that was a huge challenge. And then also the packaging and the health warning signals, as is globally a reality as well now. Smoking in public places, especially in restaurants, cafeterias, and enclosed buildings. That was a huge challenge in our country. I think one of the biggest challenges that we still face today is the enforcement and penalties, as well as education, awareness, and cessation. And this is something that the Tobacco Products Control Committee still has a lot of gray hair growing. It's a huge challenge, and even for us as Cancer Association, this is a huge challenge because people complain. Where do we go to when we need to report, and who will take the necessary legal or policing measures to control this? Okay, so I think this is something not new to any of us joining today. It's the packaging, it's the information, it's the no smoking signage, it's the controlled environments in hotels and lodges, office buildings, all of these things. And I always laugh and I say I've got many, many years of experience, even in smoking myself as well. In my previous life, I was a journalist, and I remember having a smoking office. And as a journalist, a rookie journalist, way back in my late teens, we actually were sitting and smoking in the office. Can you guys believe that? In an environment that is enclosed, no windows open, an air conditioner, as a lot of journalists, from senior to most junior that I was at that stage. And we didn't know about the harmful effects of this. And therefore, I always say, I'm not perhaps the best CEO, but I am the best CEO that have gone through all of these challenges, personally having experienced it and knowing how very bad it is for our health to be in such environments where smoking is all around us. Now, we talk about taxation, and WHO identifies taxation as the single most effective intervention for reducing tobacco consumption. Now, although the Namibia situation, we have tobacco taxation and we talk about it, it does not truly establish tobacco taxes. The act itself and the fund and where the money goes, that always is a big challenge, and it's a question. So government is currently considering increased tobacco taxes as part of the broader tobacco control reforms. But the question that everyone begs to ask is, where will those taxation funds be utilized? In cessation programs, in prevention programs, in support programs, or will it be utilized in cancer control programs so that people have access to treatment? Smoking cessation, colleagues, is a huge challenge. And I want to ask a question from my side personally to all of you is, who of you in your countries have effective cessation programs? Because the Act recognizes the importance of education, public awareness, behavior change, reducing tobacco dependence, and a government-led tobacco control program. However, in my country, we currently lack a national smoking cessation program. We don't have a national quit line. We don't have dedicated cessation clinics. And routine nicotine replacement support within the public health sector is also lacking. The funding for cessation is a challenge. How do you tell someone, stop smoking, your health and your life depends on it, if you have no means of supporting that individual? A big challenge that we are facing currently is vaping, e-cigarettes. So we have got a huge challenge with hubbly bubbly, but one of our biggest challenges right now is the green smoke surrounding e-cigarettes, that vapes are healthy and it's better, and therefore, because it's not part of the Tobacco Control Act, it has found its way into our schools, communities, even into our hospitals, even into our primary schools. So the Act was written before the rapid emergence of electronic cigarettes, vapes, and all of these disposable devices. And as a result, nicotine vaping products fall largely outside the existing regulatory framework, and it's very difficult to police it. It's marketed to young people. It's cool, it's fun, it's nice, it smells. It gives these big plumes of smoke that makes it very cool and fun. And there is truly a challenge with regards to control, importation, retail, communications and marketing management, and then definitely enforcement thereof is a huge challenge. Now, why this matters, and this is why we're all here today, and from our side, youth vaping has increased internationally. It delivers highly addictive nicotine to our younger population because that is our target audience that we have experienced. It appeals through the various fun flavors. It is heavily marketed on social media. It is not controlled at all in malls and stores. You can walk past a shop in the shopping center. It is not a tobacco product and therefore it falls outside the Tobacco Control Act. And this in turn leads to nicotine dependence. The one leads to the next. And without updated legislation, we have no legal authority to manage this rapidly evolving product list, and also that go see our schools are struggling with it. Ministry of Education, Ministry of Health, Cancer Association, we're all trying our best. And school programs, even a standing committee in Parliament is moving through the country to talk about and hear about what these challenges are. We are finding that even children in primary schools are carrying these devices. A few newspaper articles, but something that stood out for me was many vaping products contain highly addictive substances such as nicotine. A vape, also commonly referred to as a choof, is an electronic cigarette induced as a safer alternative to traditional smoking. However, social influence among young people have become more addictive than the nicotine itself. So it has become a very dangerous trend globally, and we're struggling with it in Namibia. There is our Honorable Minister of Education leading this campaign, driving through Ministry of Education that this is dangerous. We need to put a stop to this. So what we have recommended is a modernized Tobacco and Nicotine Products Control Act. And this should include regulation of all nicotine products, licensing of vaping retailers, product registration, age verification requirements, flavor restrictions, marketing restrictions, and that is all of these included in tobacco, traditional, as well as hookah, as well as e-cigarettes or vaping. Then the regulation of online sales. Very big challenge. As the world moves forwards and we go digital and online, e-stores and e-cigarette online platforms are readily available with a purchase, drop and go. Children don't even need to stop in a shop anymore. It can be delivered to your doorstep within a few minutes. Obviously, the plain packaging requirement should run from traditional tobacco products through to nicotine products as well. And then we definitely call on stronger enforcement powers, a dedicated cessation service, and a sustained tobacco control funding. Because if we haven't got funding, we can't do anything. My friends, the proposed amendments are under consideration, and I'm very thankful that the Ministry of Health and Social Services have listened to our concerns. Within the Health Ministry, they understand the challenges. And the key policy directions include stronger tobacco taxation, so that is already part of the amendment proposal, strengthened enforcement, expanded tobacco control funding, better protection of children and youth, modernization of legislation, and addressing new nicotine products, including vaping devices. So we must continue to talk so that control can be enhanced. Conclusion. The Namibian Tobacco Control Act of 2010 has provided Namibia with a strong legislation foundation for tobacco control over the past decade. We know that the tobacco and nicotine landscape has challenged and changed and progressed rapidly, significantly, powerfully, I want to say. And we always see that innovative, alternative, clever approaches are used to get the younger generation hooked. And nicotine addiction is one of them. Now, there's always the debate, if it's nicotine addiction, it might lead to tobacco. If not tobacco, then nicotine, the vaping is safer. The reality is there is no safe alternative. The best alternative is a quality-informed decision that the youth can take without being influenced by the tobacco and nicotine, I want to call it now, industry. So the updating of the Act in Namibia, and I think for all of us globally, especially in Africa, provides an opportunity to protect young people, strengthen public health, improve cessation support, enhance enforcement, empower policing, empower the gatekeepers to do their job, and align Namibia with evolving international best practices under the WHO Framework Convention on Tobacco Control. I thank you very much. If there are any questions, we'll look at them at the end, but please add your opinions because we as Namibia want to learn from you. Thank you very much.
Fantastic presentation there, Rolf. Thank you so much. Let me open up the floor to Phoebe Ongadi. She is the Executive Director of the Kenya Network of Cancer Organizations, abbreviated as KENCO, which is an umbrella body of over 70 civil society organizations engaging in cancer prevention, treatment, and survivorship. Phoebe, over to you.
Thank you very much, Ngarii, and thank you very much, all the organizers and the conveners. And listening to Rolf talking, it's like he was talking on behalf of Kenya, because it's like we are almost in the same level in tobacco control, tobacco advocacy. And it's very interesting to see that the gains that are happening in one country are happening across the continent. So that is very encouraging. So basically, I'll just start by just a minute, indicating what we are all about. So Kenya Network of Cancer Organizations, we are the national umbrella body for cancer-based civil society organizations in the country. And it's also important to note that we are part of a coalition that has been driving tobacco reforms in the country. And the coalition is called KTNTC. It brings on board organizations that leverage on their capital, on youths, and also their strength in advocacy, strength in legislation. And together we are pushing for equitable tobacco and nicotine taxation as a cancer and NCD prevention strategy in Kenya. So while we have a lot of concern, just like Namibia and across the continent about tobacco, is that cancer is increasingly a growing concern in our country. Currently, the number 3 leading cause of death. And looking at the statistics, we are diagnosing that the numbers dying are more than half of those that we are diagnosing. So it means that we are diagnosing most of these cases late. And we are recently witnessing a shift on age, where we are having more of the younger population also getting diagnosed with cancer. And our 5 top most commonest cancer in the country are breast, cervical, prostate, esophageal, and colorectal. And those are very important to us in tobacco control, because we are seeing esophageal cancer and colorectal cancer, which are the number 4 and number 5 commonest cancer, being linked directly to tobacco exposure. So for us, tobacco control and tobacco prevention, tobacco taxation is not only a matter of data or a matter of information, but it is a matter of public health concern, because it directly contributes to the prevention and reducing not only tobacco-related cancers, but also the non-communicable diseases. Almost 12 cancers are directly linked to tobacco exposure, and 30 to 50% of all cancers have been proven to be able to be detected and totally prevented by just reducing the exposure to tobacco. So in my country, prevention, what we are facing as a big challenge is the emerging products. And just like Namibia, emerging products we are facing as a big challenge, and we are still pushing for prevention to start before dependents take control of these adolescents and young adults, because we are going to look shortly that the first dependence, the first influence, the first exposure is directly linked to long-term addiction. And looking at Kenyan tobacco data, which is also not so clear, as of 2022, 2.3 million Kenyans were reported to have used a tobacco product. And all those, out of over 244,000 of those were adolescents, and they're currently using tobacco and nicotine products as of 2024. And of concern is the adolescents that are trying. 6.5% of adolescents as of 2024 reported to have tried a tobacco. And most of the times they reported that they tried not only in the family setup, they tried in the school setup, they tried in the social gathering setup. So then you see that data, the 6.5% may look little as of now, but this is the population that will eventually get dependent on tobacco and nicotine, and this is the population that eventually contribute to rising cases of cancers and NCDs. So the youth and emerging nicotine products, we are concerned as a country because there is emerging trend to make it look normal, to make it look flavored, to make it look like the fashionable thing. Ministry of Health reported that over 40% in 2024, 40% of Kenyan adolescents reported seeing nicotine products advertised on social media. Right now, a studies an average of children from grade 8, grade 6, grade 4 already have an access to phones, and most of the times these phones are not regulated. We do not know the advertisements that come through it. So then there's a lot of misleading content online, and then we have to ensure that we continue speaking up to protect this future generation. So we are facing as a country a broader nicotine landscape, not only on the counters of the cigarettes and the shisha and the vapes, but online. So then the surveillance challenge that was presented by Ngarii is real, because the product being innovated, they are moving faster than even the policies. So then this agenda is timely to ensure that this increased experimental risk is considerably reduced. And just like Namibia, what is working for us currently is that Kenya has a very strong tobacco control foundation under the Tobacco Control Act of 2007. So this tobacco control restricts smoking in public places, and this has really happened very well. It also protects children from tobacco sales. Remember, it is protecting children from the over-the-counter tobacco sales, but then there is still a gap of preventing these children from ordering the e-cigarettes and the emerging products online. And then also it helps to control advertising and promotion. If you look at the photo on the left, this is as early as last month, and this was passed by the Ministry of Health. Part of the coalition's efforts across the country, they have improved on the graphical health warnings, and even walking around the streets, you find this in billboards, which is a very good progress at finding it in billboards and having the healthy lung and the tobacco lung clearly indicated there. And then the graphical warnings in legible handwritings that can be read in both the local language, which is the Kiswahili, and also in the English language. So the act will restrict that, but then the law was developed before the current proliferation of the e-cigarettes, of the vapes, of the nicotine pouches, of the synthetic nicotine. So then this has already created a regulatory gap that even as we are pushing for the smoke-free environment that is already enacted in the law, the current act is looking at how to strengthen these regulations to ensure that the gap of the sales of these e-cigarettes and the emerging products are protected from the children and protected from the adolescents. Therefore, Kenya is considering the Tobacco Control Amendment Bill of 2024, and that is where we are. And this control is seeking to bring these emerging nicotine products more explicitly within the regulatory framework. So as of August 2026, this is as early as this month, that amendment remains a bill, and yet that is what the coalition is part of what we are pushing for. So those are some of the gains that we have done. And then now, as a country, what requires attention, as we have mentioned now, is closing this regulatory gap, closing the gap as far as legislation is concerned, and then protecting the schools and the youth spaces. If you look at the data that we presented, most of these children are trying these nicotine products around the canteens in the colleges, around the canteens in the school, and they're being packaged as flavorful sweets, flavorful, colorful to attract, and then they're being packaged as harmless and harm-free. So then we need to strengthen the tobacco taxation, because we know as a youth, as a child, they're depending on parents for pocket money, for upkeep and all that. So the higher these products will be, the higher it will be, the more challenging it will be for them to buy. So then we also need data. We represented the data that were kind of just an average, but Kenya needs regular, nationally representative youth tobacco and nicotine use data. And this data not only will influence decision making, but it also influence policy shift. The other day we got a setback when shisha that was on hold for a long time was now approved by one of the courts to be allowed to be distributed across the country. If only we had the data behind shisha, probably that would not have been the case. And then we are pushing towards preventing tobacco and nicotine addiction before it starts. We have prevented tobacco addiction with the cigarette advocacy, but now having and ensuring that the issue of nicotine in the vapes, in the electronic cigarettes, is also included as a health concern. Number 3 leading cause of death, and a totally preventable risk factor for cancer and many other.
Phoebe, are you with us? Am I the only one whose screen is freeze?
No, she's also gone from my side.
Okay. It looks like the electricity might have shut down because her screen just froze and the lights seem to have gone off. Now, okay. Now, in the interest of time, I think we can have Phoebe do closing remarks as well as a way to continue her presentation. But in the interest of time, let me introduce our last speaker, who is bringing along the youth voice, because at this type of discussions, one of the challenges that are advocated by individuals is that where is the youth that should represent and advocate for what they need to speak for. Let me introduce Leena Amwaalwa. In 2026, she was honored as the Queen's Commonwealth Trust 100 Young Leaders by the Queen Elizabeth II Commonwealth Trust. Leena is widely recognized for her advocacy on gender justice, community empowerment, and health awareness campaigns, including cervical cancer. And she's the
Sorry about
founder
that.
and
Let me
director. Yes, please.
Sorry, let me just finish on that particular last slide. Sorry about that. I think that must have been a tobacco industry interference with the electricity. Yeah, let me just finish on this takeaway slide. Yeah, so then so what our takeaway is now, how to make tobacco control as a future cancer prevention and a youth protection as an entry point. Those of us who are in Kenya know that we are currently having conversations around Vision 2060, Vision 2030 and beyond. So then we will highly rely on data in the future to help us guide prevention and policy shift choices. And then also we need to regulate not only the cigarettes, but also the shisha, the vapes, the nicotine as one nicotine control agenda, not just the cigarette. So when we are seeing the graphical or health warnings in the billboards and also on the cigarettes, we also expect that to find its way on the online. And that will be ensuring we do not even have, we ensuring that we tone down on the influencer campaigns, on the online campaigns, on the online shifting, and then closing completely the digital marketing around the school zone loopholes before they normalize, and ensuring that we protect these adolescents before they even test. And then finally, what we have seen work with the Tobacco Coalition is ensuring that we keep the CSOs, the survivors, and the youth voices at the center of accountability. One of the reasons why we made very good progress with the taxation is that we did not say anything, but we brought on the room cancer patients and lung cancer patients who have had exposure to tobacco, exposure to nicotine earlier on speaking, and that alone was able to convince the policymakers to push this in the front. Thank you so much, and that will be the end of the presentation.
Phoebe, thank you so much. Beautiful, beautiful discussion there. I apologize for the tobacco interference. Tobacco interference there. Thanks for that wonderful joke. Leena, over to you. In the interest of time, I've just basically concluded your introduction. So please do kick it off.
All right. Good afternoon, everyone. Thank you very much for having me here today. And thank you to our colleagues at Gateway Development for setting up this timely conversation. Equally, I would like to appreciate Mr. Hansen and Ms. Phoebe for doing all the groundwork and laying the foundation of this conversation. So mine today is just to bring the voice and the experience of the youth when it comes to the use of nicotine products. So now, in the work that I do in the community, I had the privilege of engaging a diverse pool of young people coming from different backgrounds, different experiences, and all that. And I get to learn about the realities that shapes their choices. And I came to realize that cancer prevention cannot wait diagnosis. It must begin now. And while Mr. Hansen was actually presenting, he reminded me of an incident that happened 2023, where I was called at one of the primary schools where I had the privilege of serving as an honorary school board member. And there was an incident where grade 6 and grade 7 young boys and girls came to school and smoked the Viper, I hope I'm pronouncing it correct. So now you are looking at the scenario of where a very young child at that age is engaging in these products. And I came to the realization that they don't do this with, say, cancer statistics at the back of their mind. They do that to try to navigate their curiosity. They do that due to peer pressure. They do that due to stress and other social influences, as well as the need to belong. So now, this is why it's looking at a scenario like this that we need to understand not only whether young people are using these products, but we need to understand what are they using, why are they using it, how accessible is it, and what is influencing their decision. Now, in the cervical cancer spaces where I operate, this connection between the nicotine products and cancer is actually important because high-risk infections such as the HPV, particularly number 16 and 18, which are the major contributors of cervical cancer, are caused by the persistent and progressive, they are caused by the increased persistent and exposure to tobacco products. So when we talk about cancer prevention, we cannot afford to fight, or when we talk about cancer prevention and the use of tobacco products, especially amongst young people, we cannot afford to fight these risks in silos. We need to bring our efforts together and see how best we can address them. Now, despite the warnings, because in most cases we will hear, don't do this, don't touch that, don't go there, and it's rightly so. I'm convinced that, or I would like to believe that our young people deserve accurate, accessible, and age-appropriate information about the use of these products. They also need to understand HPV, the vaccination, and screening. But most importantly, our young people deserve to be heard. Now, in closing the data gap in these spaces, it means that we need to put the young people at the center of our conversation, at the center of our initiatives, and at the center of our efforts. This means we need to capture their lived experiences. We need to understand what is driving these young people to these products. And we also need to translate the evidence into our prevention programs, our policies, and and what actually resonates with the lives of these young people. In fact, I appreciate the fact that Mr. Hansen highlighted our act, and as it has become a norm in most spaces, Namibia looks good on paper, especially when it comes to these things, but when it comes to implementation, there is lag. And I'm happy to hear that the ministry is actually working on implementing some of these things, so we are hopeful for the future. Now, based on the previous speakers, we've learned that the scenario is the same in Namibia as it's happening in Kenya, and I would like to understand that it is the same for young people everywhere. So now, we learned that our shared challenges are just the same, be it back at home and in other countries. And my conclusion is that if we want fewer young people to face preventable cancers such as cervical cancer, for example, then our research, our policies, and our prevention efforts must reach them today, and not only reach them as in telling them don't do this, or as in collecting data, but then also we need to understand what is driving them to these products, and how best can we keep them from spaces that leads them to engaging in such products. With that, thank you very much.
Thank you to our three speakers for sharing your insights. We would like to go into a session of question and answer. If you have got any questions for our panelists, please post them in the chat. And as I wait for you to post, I have got one question to both Rolf and Leena. And the question is, how can we broaden our civil society coalitions beyond just tobacco or cancer control to bring in more people, both for the controlling of the nicotine and other new projects, but also just to broaden tobacco and cancer control in country? Because I note that Rolf is from the Cancer Association and Leena works in the gender movement. So what tips would you be able to give to the rest of our audience on broadening coalitions, and which new people do we need to bring on board? And then after they answer that question, a question to Phoebe. And so Rolf mentioned that they have a tobacco control fund, but it is currently not funded. What lessons could they learn from Kenya that similarly has a tobacco control fund? And what more can we do for sustainable financing? So over to you, Rolf and Leena, and then to Phoebe.
Thank you very much. Yes, I think as Leena has expressed, working in silos is our biggest challenge. This is a common phenomenon in Africa, especially. Africa is big, we must remember that. And people often say, take hands and work together, but it is very difficult. However, if we're not going to work together and make an effort to open up the borders of collaboration, twinning, partnering, we're not going to get it right. I'm very fortunate that I have had the funding opportunity to establish the African Patient Organizations Connect. It is an act of love from my heart, because in Southern Africa, we work in silos. South Africa, and I know my colleagues from Cancer, our partner organization, and as Cancer Association, we come from the cancer in South Africa, is big. And South Africa is big, and they have got things going in their country. But then comes the rest of Southern Africa, and we're quite alone because we're small populations. And then comes the powerhouses of the north, like Kenya, like Uganda, in Ethiopia, in Nigeria. Things happen because people speak up, because it's more coordinated. And I think that is what Africa needs right now. A deliberate attempt to come together and to coordinate and speak as a collective African voice when it comes to cancer.
All right. From my end, I would like to just continue on what Mr. Hansen said, in a sense that once we as advocates come together, once we combine our efforts, and I'm happy and I'm hoping that this conversation was just the beginning of many to come. My contribution is that once we as advocates combine our efforts and we come together as a community, we can then reach out to our people, because I feel like people are more prone to listen to a group compared to just one person reaching out to them. If we reach out to our communities as a team, a united front for that matter, then I'm convinced that we are going to make a difference, especially if we reach out with empathy and with understanding. Another thing is that if you come across most information in our communities, you find that it's mainly in English, and I understand that English is our official language in most African spaces. But I would like to believe that once, if we'd like to take this message to the people, it would be great if we can do this in our vernacular languages. To say, when we are going to the people, let's go to them with information in the language that people understand the most. I'm convinced that way we are going to make a difference. And perhaps we should also reach out to people in approaches that make sense to them, if I can use that word, to say, if I'm reaching out to young people, let me use a language and platforms that are more appropriate to them. If I'm reaching out to professionals, let me reach out to them in a language that they understand. If I'm reaching out to our elderly in their communities, deep in the villages, let's reach out to them in a language that they understand. I'm certain should we do some of these things or all of these things, then we are obviously going to make a difference. Thank you.
Thank you very much. Yeah, thank you. Can you hear me?
Yes. Go ahead, Phoebe.
Can you hear me? All right, thank you. Thank you very much. On the question on what they can learn on the tobacco control financing, the Kenya's Tobacco Control Act, for 2014, established a tobacco control fund. So this tobacco control fund is also what is called the Solatium compensatory contribution. It is meant to be the contribution on the value of tobacco products, those are that manufactured in the country and also imported. So this Solatium fund is important because it helps to activate it is meant to finance Ministry of Health prevention mechanisms around non-communicable diseases, around preventable illnesses. And now with the help of the coalition, because the 2% Solatium funds on tobacco taxation is a lot of money. And what we are noticing right now is that this kind of funding, it's not really regulated. We do not know where it goes, though it is supposed to be embedded within the Ministry of Health. Now, the civil society is also coming out to say that we want a share of this Solatium compensatory contribution, because we do a lot of awareness, as has been mentioned. We do a lot of capacity building from the ground. So one of the lessons that we could share around is ring fence the money for tobacco control. Already this money is legally available. The Kenyan legal model links the contribution directly to tobacco control, rather than treating it as an unrestricted general government revenue, which can end up anywhere in the government, but ring-fencing it to work around tobacco control, tobacco-related research, tobacco-related data, documentation and dissemination, and all that, and even supporting national cessation, supporting the young people. So what we could learn from Kenya is that if Namibia could also activate the existing laws to ensure that the levy authority, through their detailed regulations, define the rate, the liable entities, the collection mechanism for this Solatium fund, because once you increase the tobacco taxation, we have to know where the fund is going. And fair enough, the fund should go towards supporting tobacco control efforts, not only for the government, but also for the civil society organizations and the non-government organizations. Thank you.
Okay, one last question to Leena. What do we need to do to be able to reach the youth, particularly in terms of communications, and not just reaching them as, I guess, victims, but how can we involve them in our efforts?
All right. So what I've come across, the complaint among most young people is that people don't understand them, or when people reach out is with criticism, because in most places you always hear these young people that, these young people this. So, like I mentioned earlier, I think if we want to reach out to young people and really make an impact, is to reach out to them with understanding. I think it's called meet people where they are. We go to the young people, trying not only to give them information, but also trying to get information from them to understand exactly what is it that keeps leading you back to these spaces every now and then. And then when we get that response from the young people, then we then should use that to develop our response to these challenges. Say, for example, if someone is telling you that, no, for me, I feel maybe stressed, for example, or I'm depressed about something, that's why I keep going to this, that's why I keep using these products every now and then. So we shouldn't approach them with judgment to say, no, but you can't be using such, or, you know, and or other criticism that we come across. But I think the best solution would be to say, maybe find out what is it that you think can happen to help you best, so then you can or maybe let's find out what are you good at, or what is it that you'd like to see happen in your future, and where we are able to, we should look into coming up with such solutions. But I'll reiterate to say, if we want to bring young people on board, we need to go to them with understanding and try to find out, why are you doing this? Who is leading you to this? Who is your supplier, for example, if I can say that? And then when we now draft our solutions, or when we come up with our initiatives, we are going to include and address all these challenges in our approach, instead of just, sometimes people just sit where they are and then they come up with the solutions apparently to young people's problems without really understanding what is happening on the ground, who exactly is getting involved in this. Because saying young people, that is a broad term, it does not really specify to say who is using this. But I feel like if we tailor it down to say, let's go and find out what is going on, who is doing what, where are they getting it, why are they getting involved into it, then I think that way we are going to solve the problem best. Thank you.
Thank you, Leena. I think we've had very interesting insights that tell us that the problems are common between Kenya and Namibia, and equally the solutions are common. And if we all get together, we can do something about the problem. On your screen, you have a QR code. Please scan it and give us feedback on our webinar. And I hand over back to Ngarii to close.
Thank you so much, Rachel. And what a great voices that we had from Rolf, Hansen, Phoebe, Ongadi, and Leena, Amwaalwa. So today we brought together, the leading voices in Namibia and Kenya when it comes to cancer. And one key fact that I want us to, depart with is from the Center for Disease Control, which states that tobacco use is the leading preventable cause of cancer worldwide, accounting for about 25% of all cancer deaths. So the agency is there, and as the speakers have highlighted as well, it goes beyond the data. We see it in livelihoods, we see it on the ground, we see it in our populations, in our family members, as consequences in the neighborhoods that we live in, the consequences and the negative consequences, negative externalities that they call in society that comes from this type of tobacco use. As a consequence, it's important to highlight also that without the research and the data in place, policies cannot also impact change. So it's important to actually, invest in this type of work, invest in cancer promotion activities, and join in those voices to promote a better society for everyone. Ladies and gentlemen, concerns of time, thank you for the 1 hour that you've come to join the Closing the Data Gap, Driving Tobacco Reform and Cancer Prevention in Kenya and Namibia. I thank you and appreciate the voices and the questions and the great participation that you shared with us today. Thank you. Have a great day.
Thank you.